Hi everyone, I'm Dr. C.P. Ravi Kumar. I'm a consultant pediatric neurologist based at Aster CMI hospital in Bangalore. In this video, I'm going to trace an awareness about when to meet a pediatric neurologist. Pediatric means children. Neurologist is an expert in the nerve disorders. So any individual who are less than 18, sometimes we say less than 16, who have a neurological issue has to consult preferably a pediatric neurologist wherever they have access to. So common condition which needs help from a pediatric neurologist, developmental delays. If there is a delay in the development of milestones means motor like sitting, standing, walking, speech, cognition, and also sometimes with hearing and speech. It is very common in children who have issues at the time of birth. Even without any injury at birth or any problems at birth, later these individuals, some children can develop problems and that needs to be addressed. Second one is abnormal movements. This we see as one is seizures. People are very familiar with this. There are many words that are used to refer to seizure. One is seizure, fits. In Hindi they call it mirgi. In Kannada they call fits. So these are all very slang words, but the medical terminology is seizure or epilepsy. When you have these conditions in children, it is very unique. There are many disorders which mimic or look like seizures, but they are not seizure. At the same time, there are many conditions which look so normal, but they are seizures. So it is very important for you to get an advice, do the right investigation, and if necessary, take the right treatment for such abnormal movements. The third one is learning, behavior. These days, these are very common. Often, they're unrecognized or not given adequate importance. Why is it? Because many times parents feel they're not very happy or a resistance to accept their children can have learning issues. Unless it is very severe, especially those in the border, they always struggle. But ironically, it is those who are in the border whom we can help and make them better. Those who are having on the extreme spectrum, maybe it is difficult to change it, but those who are in the border, they need a little bit of help, a little bit of guidance, and then they can do better. So it is very important if you have these issues to get it addressed. Behavior, social interaction. If there is a concern, please try to meet your pediatrician or a pediatric neurologist at the earliest. These days we see autism, developmental disorders, which are especially social and communicative disorders, have become very rampant in metropolitan cities like Bangalore. This is mainly because of a breakdown in the nuclear families or joint families, working couple, prolonged exposure to screen time. The screen time is here exposure to digital devices like TV, mobile, computer, laptop, tablets, whatever you call it. They're all put together as called a screen time. There are a lot of videos on screen time. Please have a look. But if you notice any of these changes, please meet a neurologist. Once again, to summarize, seizures, developmental delay, behavioral issues, learning issues, anything, please reach out to your pediatric neurologist. Thank you.